Hi, this is Christine. Welcome to my channel, and I'm going to be talking to you today about AI models transforming healthcare businesses and what you need to know for 2025. So imagine a world where patient care is faster, more accurate, and costs less. That's the power of AI in healthcare. So I'm going to be introducing the topic, and in this video I will explore with you different types of AI models that's revolutionizing the healthcare businesses and how you can implement them in your operations. So stick around to the end and I'll share with you the top recommendations for affordable AI tools for small businesses. So what are AI models? AI models are systems that are trained to analyze data and perform tasks like decision making, predictions, or automations, for example, repetitive processes. It's there really to push things faster than what we usually would do, for example. So the highlight of the relevance to healthcare is that scheduling the appointments to even down to diagnosing diseases, AI is reshaping the industry. It really is. So the types of AI models in healthcare is predictive analytic models. So what do? They analyze patient data to predict outcomes like disease risk or recovery timelines. Some examples are AI producing hospital readmissions, for example, predicting hospital readmissions or complications after surgery. So the benefits for businesses are that it reduces costs, that it improves care plans, and it also optimizes resource allocation. So natural language processing. What do they do? So the process and understanding human language from patient records, transcriptions, or online reviews, for example. AI-powered chatbots for patient support or transcribing doctors' patient conversations is very beneficial. It saves time, it improves communication, and it also enhances patient satisfaction. So the computer version model is that it analyzes medical images, imagine that, like x-rays, MRIs, CT scans, and detects abnormalities. For example, AI can detect early stages of cancer or eye diseases. So the benefits for businesses is that it's faster at diagnostic, it reduces resilience and, reliance on specialists for basic analysis. This is what it's meant to do in terms of it's meant to help enhance the human that is working with the AI. It's not there to replace AI. So the AI is not there to replace the humans. So we tend to get this a bit mixed up, and it is, this is completely new and it's looking a bit scary, and we don't know what the outcomes is going to be 10 years from now, but I'm here to talk to you about how you can start looking at introducing some of this so that you're ahead of the game with your business. And this is all about your business strategy and implementation, your business plan, using this in this way. So workflow automation models, what do? They automate repetitive tasks like billing, insurance claims, and appointment scheduling. Example would be the AI like robotic process automations handle administrative work. The benefits for businesses are that it saves time, reduces errors, and allows staff to focus on patient care. So what do they do? The recommendation systems is it suggests personalized treatment or medication based on patient data. An example here would be AI recommending tailored rehab exercises or diet plans for patients. So what are the benefits for those businesses? So it would improve care outcomes and patient loyalty, for example. So the benefits of AI for healthcare businesses is that it's efficiency, it's enhanced in its operation, it reduces costs, overhead costs, it improves patient experience and satisfaction. There's also the data-driven decision making for better outcome. The challenges and considerations to face are that it's the initial setup and training costs, ensuring compliance with privacy and also like HIPAA, GDPR, and choosing the right tools for your business size needs, because not one size fits all. So how do you start an AI in your business? You identify the repetitive tasks that you're currently doing that could be automated. Smart, small, with affordable tools, i.e. chatbot software, for example, and this can be used alongside with virtual assistants. As we're a virtual assistant agency, we have done this on numerous occasions. So partner with consultants that specialize in healthcare AI, for example. So AI is no longer a futuristic dream. It's a reality, and you can implement today to make your healthcare business more efficient and impactful. If you want personalized guidance on integrating AI into your business, join me for my free 2-day bootcamp, which is free on December the 27th and the 28th, starting at 2 p.m. and it finishes at 7 p.m., for example. And this is UK time that I'm referring to. So let me just go into a bit more in depth. The session here is I want to be able to discuss you growing your AI healthcare business, streamlining your operations, and improving your patient care, for example. Think about the growth that's happening in AI. It's everywhere. Everyone's talking about it all the time, right? So what you need to think about is building a solid foundation for building a business plan around AI tools, because the business plan that we've got is outdated, so you'll need to update it with AI in your business plan if you want to stay ahead of the game, that is. So identify what the challenges are is administrative inefficiency, for example, in healthcare challenges, high cost of patient care, for example, and misdiagnosis due to human error, long waiting times for patients, for example, and also if you look at introducing AI as a solution, the AI tools will be really predictive analysis and workflow automation. It's going to improve your business, for example. So hospitals are reducing costs by using automated billing, for example. So what are your biggest challenges in your business, and what do you face right now with AI that could actually solve your problem in your business? So when you're looking at doing your business plan, you're redoing your business plan with AI, you got to look at what your mission, what your vision, and your strategic objective is. So, what problems are you currently solving, and why does it matter? An example here is our mission is to improve healthcare accessibility through affordable AI tools. Another vision could be, for example, where do you see your business in 5 years from now? So an example would be to become the leading provider of AI-powered scheduling solution for small clinics, for example. That's another position that you could offer service in healthcare. Set yourself some objectives. They need to be smart. They need to be specific, measurable, achievable, and relevant and time-bound. So an example is that you want to acquire 10 healthcare clients in 6 months, for example. So who will this benefit? Small clinics, hospitals, nursing homes, or home care businesses. Healthcare businesses as well with limited administration staff. So the location and size, because you'll need to define who your audience is. What is the location, what is the size, and what is the revenue range? You want to look at who it is that you think that could benefit from AI in your niche right now. This is what you're going to be putting into your business plan. So share what it is that your company, for example, the global healthcare, the AI market is projected to grow by $67 billion by 2027. That's not far away, is it? So it is a trend, and it's looking at how you can adopt AI into your business. So remote patient monitoring, perhaps, demand for data-driven decision making, for example. Who are your audience? So what trends in your business, for example, are you going to be pushing to adapt new technologies to? So do a competitive analysis. You would identify your key players, for example, your competitors. What solutions are you offering with AI? For example, there's Tempest, for example. Find gaps in the market. So be competitive. Focus on large hospitals, but there's a gap for small clinics as well. So what I want to do is I want to ask you to identify who your competitors are in your market, and I'd love for you to be able to do some research on that as well. You've got to also have a marketing plan in your AI business plan, and that means that your channel, for example, it really does need to, you need to mention your marketing strategy, i.e. what is your social media channel going to be? Social media, LinkedIn, B2B, YouTube for education, for example, email campaigns targeting healthcare providers, partnering with healthcare associations. You're going to be collaborating more. And what are your content ideas? So use some case studies, webinars, for example. We've got to start thinking differently now with AI being here, and your business plan needs to reflect the future of how you see your business in 5 years from now, or even 10 years from now. So what is the one marketing strategy that you've seen work really well in healthcare? Do you know of that already? So think about that. The next thing that I want you to think about is your business structure. What type of structure are you? Are you a sole proprietor, LCC, a director, partnership, for example? And then you got to think about your team considerations. What skills is needed? What are the data? What's the data saying? What sales professionals do you have, for example, to help drive revenue in your business? So some tools that you can use for small teams: virtual assistants, project management software like Asana, for example. Then in your business plan, you want to create a financial plan. For example, what your startup cost is, your AI subscription, marketing, and your staffing. Then you've got to look at what your revenue streams are in your business plan, and what is your fees, what you're going to charge, what services are you implementing, for example. Project profits, for example. You want to break down what your return on investment is going to be, your automated administration task, what savings is it that you're going to do a month. Now remember, we talked about your crisis funding. Mention that in your business plan, for example, that you have got a crisis fund, that you are saving 10%, for example, towards your if the crisis does hit you, towards that. But also during your seasonal times, you will add more when you've increased more than when it's your seasonal times, as opposed to when it's your quiet times. You're still going to do the 10%, but you're going to also perhaps put another 5% in there as well. So you can use tools like QuickBooks, Excel templates, for example, to help you with the financial planning section. And what I'd like to ask you is, what is it that's holding you back from scaling your business with AI? Have you done a business plan? Is your business plan up to date, for example? Or are you still working with the business plan from 5 years? Because really, business plans should be done yearly to keep up to date and to really push forward with what the future goal is for your company. So if you found this helpful, I'd love for you to join our free recovery bootcamp, which is on the 27th and the 28th, where I will be diving deeper into these strategies for 2025, sorry. So thank you so much for listening today, and I hope that you've enjoyed it. I've had to redo this video because it was lagging a lot, for example, so I've redone it so it's a fresh one. I hope that you've enjoyed it, and I look forward to the next live with you, and I will see you on the internet. Thank you very much. Take care. Bye.